Perhaps one of the most difficult topics to broach with a patient is that of concern about potential substance use disorder. Perhaps via your opioid risk mitigation strategies, you have identified a concerning pattern of behavior. Perhaps your patient was admitted for an overdose, and you received the discharge report. Perhaps your patient tells you directly. Either way, your approach and demeanor can make all the difference in the ultimate outcome. Our favorite teaching tool on communicating concern with a patient comes from the CDC Addiction Medicine Toolkit entitled Empathy, Talking to Patients About Substance Use Disorder. First, ask permission. Your patient may not be ready to discuss their substance use. You can share that you are concerned about their well-being. Here, it is important to be non-judgmental and ensure they are comfortable proceeding with the discussion. Reiterate that substance use disorder is a neurobiologic disease and that you can help whenever they are ready to discuss. Second, normalize the conversation. If your patient appears to be open to discussing their substance use, reassure them that it's normal to feel uncomfortable, but that they are not alone and you and your staff are there to help. Do not tiptoe or express embarrassment. Here is the point where it is absolutely critical to demonstrate empathy and pay particular attention in avoiding any stigmatizing language. Once you've demonstrated concern in a caring and non-judgmental way, ensure that you are transparent and let your patient know that you need to ask some very specific questions about their substance use. Use extra caution to avoid any verbal or nonverbal cues that might demonstrate to the patient any feelings other than compassion. Remember, your patient may not be ready to fully engage in treatment at that time. This is the time to exercise your shared decision-making skills. Collaboration is key. The patient should truly feel you are in their corner, regardless of when they are ready to proceed. Finally, establish trust and demonstrate empathy. This is achieved via truly active listening. Being completely non-judgmental and reassuring your patient that substance use disorder is a medical disease and not a shortcoming or a lack of willpower. Discuss possible treatment options based on patient preferences and co-occurring health conditions. Information about communicating concern with patients, as well as other helpful resources, are available at www.ilpmp.org. This prescribing tip is brought to you by the Southern Illinois University Edwardsville School of Pharmacy and the Illinois Prescription Monitoring Program.